A few more names that are currently on injury reports around the NFL are about to be addressed by Dr. Sara Edwards from West Coast Sports and also the team doctor for the Cal Bears. She's here to give her expertise as she now joins Andy Behrens to break those players down. And of course, Tank isn't booing you.
Big game week. Boo!
Of you being here.
I love Lady Doc.
But the little Stanford-Cal rivalry that we have. But what do we have in terms of what's happening in fantasy today, Doc?
Are we sure that these two don't need to be separated? We're good?
We might. Next week, we're going at it. Thanks for having me on again today. So the big injuries this week, this Green Bay Packers wide receiver, Jimmy, help me with the last name.
Jimmy Graham.
Jimmy Graham.
Tight end of the Packers. Kind of a disappointing season to this point, but actually does lead all players at his position in targets inside the 5-yard line. He's obviously somebody who is relevant to their red zone offense, playing with a fractured thumb. I didn't realize this was the kind of thing that a receiver could play through.
Right. No, it is actually. It's interesting. When you have a thumb injury, there's different bones in the thumb. So there's 3 different bones. You've got the distal phalanx, the proximal phalanx, and the metacarpal. And any of these bones can be broken. So it's a very kind of nebulous description that he has a thumb fracture. The fact that he's playing without surgery tells me that it's probably a stable little tuft injury, something that they can put a splint on. He's obviously incredibly tough. It is going to be painful for him. So the fact that he can get in and play week 1, catching Aaron Rodgers, he's going to be throwing hard. Tells me that he is mentally strong and physically strong, but it must be a stable injury.
Where did Aaron Rodgers go to school?
Cal, that's Cal, Tank.
Duke Community College.
Let's talk about our quarterbacks in the NFL. Jared Goff, Aaron Rodgers, we've got a good history there, buddy.
So we think Jimmy Graham is going to be his usual mildly disappointing self.
I think, he's going to play with pain. But yeah, I think they'll have him splinted. He might even be partially casted, which sometimes can help them. They'll put him in a functional position so he can catch a ball, and he should be fine.
So it's almost certainly not this one where it's sort of deep in the thumb.
Right. When it's at the base here, these are the ones that need surgery. So that would definitely be an operative one. But, if it's more at the end, at the tip, it's just the tip, not that big of a deal.
Yeah. Well, let's move on to Kerryon Johnson, who has just been a really fun breakout rookie, averaging almost 5.5 yards per carry on the season. Had really taken over the featured role for Detroit. And now he's dealing with a knee sprain of kind of sort of unknown severity, probably not an ACL because we're still talking about him playing this year.
Yeah, absolutely. The reports on him coming out are actually pretty good, I think. This is always good news if it's just a sprain and not an ACL. An ACL injury would put him out for the year, obviously, and he wouldn't be able to compete at the running back position like he is anticipated to. Again, the main ligaments in the knee, you've got the ACL and PCL in the middle. The MCL and LCL are on the side. So I imagine when they're describing an knee sprain that they're talking about the MCL. That's the most common knee injury that you will see in football. And again, 1 to 2 weeks, he should be back. So we know he missed 1 game against the Bears the other day.
Missed the Thanksgiving game.
Yeah, he missed the Thanksgiving game. I think he has a high chance of coming back next week, maybe the week after if it's taking too long. But I imagine he'll be back next week.
All right, so relatively good news if you've invested in Kerryon Johnson. We have to talk Alex Smith because it was just a gruesome injury. Great career. You hope this isn't a career-threatening injury. It was a compound fracture, a spiral fracture, multiple breaks. What can you tell us about his prognosis, not only for his career, but like any chance that he's available next September, October, next season?
That's a great question. Obviously, everyone around the world is talking about this injury because it was caught on film and was so gruesome. What we know about it is that it was a compound spiral fracture. Spiral just describes the torque that was applied, so it was a torsional injury. So that doesn't get me too worried. But when they say compound, that means that the bone is actually penetrated through the skin. And that is an emergency. He had emergent surgery that night. And this is what an x-ray would look like of someone with that kind of injury. So you see there's 2 bones in the main part of the leg. You've got the tibia, you've got the fibula, and this would show someone who's penetrated through the skin. So unfortunately, that was the injury he had. And then we're not quite sure how they fixed it. So sometimes they have to be rodded, where you'll put a big metal rod down the middle, or sometimes they're plated with screws. The rods I always hate in an athlete because you have to enter through the knee. So you create almost a second injury by entering through the knee. I'm hoping that they were able to plate him. And, the question is, when could he come back? And I think at the minimum, it's going to take him probably a year. I doubt he would be available by next September. hopefully he surprises everyone, and obviously he's in top physical shape right now going into the injury, and he'll have all the therapy in the world helping him. But my experience with this injury is it takes people a long time to get back to what they consider normal, and his normal is obviously a standard above most humans. So,
Sure.
I think it could take him up to a year to even 18 months to fully recover.
Oh, so we're looking at Colt McCoy for the rest of the season, and Washington probably has to add a quarterback going into next year. And the choices available in free agency are not going to be great this year, so really rough news.
Thank you, Doc. Hopefully you're still enjoying your breakfast after that one.
Right? Hey.